Tonight, Cronkite News continues our commitment to covering Arizona's heroin epidemic. Governor Doug Ducey blames much of the problem on the proliferation of prescription drugs.
Cronkite News investigative reporter Ty Scholes looked into the medical data behind these dangerous drugs.
Cronkite News has been tracking heroin's hold on Arizona since last year, but even more people are having deadly encounters with prescription drugs, landing them in emergency rooms across the state. Brittany Pinkston was prescribed Percocet by an urgent care doctor after a hand injury.
The very first one I took, it was the best thing of my life. And I literally said, I'm going to do this every day for the rest of my life.
Within a month, she was hooked.
For over a year, I did it a lot. Because if I couldn't find any on the streets, I could easily go to urgent care and they'd prescribe them to me in a second. I knew exactly what to say. You just go in and say my back hurts and they'll give you a Percocet. I got one in the waiting room once.
It happens all the time.
So if you look at the United States, we actually represent only 5% of the world's population, and we represent 80% of the prescription drugs.
State records show that 1,052 people required emergency treatment for prescription opiate overdoses in 2014, up from 1,018 in the previous year. Heroin overdoses also continued to increase from more than 521 in 2013 to 605 in 2014.
Most drug abuse, specifically in the heroin arena, starts by using legal prescription drugs, 75% in fact. So if we can identify individuals up front who are at risk of becoming addicted, we can intervene and help them and save lives.
Dr. Dan Kwan at Maricopa Integrated Health System sees overdoses every single day.
I had one patient that said he was hurt at age 8, and that's how he got addicted to pain medication. He didn't know any better because he was so young, so he just kept escalating from there.
Nick Sanders was a pill addict too. Like many teens, he got his first pills from a friend.
When I first got high on it, I mean, it really felt like, the heavens had parted and I'd found, what I should be doing finally, like I was always anxious.
Former addicts tell Cronkite News they did whatever it took to get the drugs. Doctor shopping, even armed robbery.
But the funny thing is you think you're not that bad until you can't get the doctor to prescribe you pills, and then you're like, holy shit, this is a problem.
Sanders robbed a Walgreens.
I flashed him the gun real quick, he hands me the pills, and I pretty much just walk out the fire exit.
Arizona legislators have a plan to help combat prescription drug abuse. A Senate bill sponsored by John Kavanaugh would require doctors to check a database before prescribing narcotic substances.
In order to save lives and prevent all of the accidents and crime and heartache that follows opioid overdose or intoxication, we're going to mandate it because it just has to be done.
That's the thing. You doctor shop. Any pillhead you talk to, they've doctor shop. That's the point of it. Of course you do.
If the bill passes, it would likely be much more difficult to support a habit by doctor shopping. With the investigative team, Ty Scholes, Cronkite News.
Arizona PBS will continue our coverage of the heroin epidemic this evening. Coming up on Arizona Horizon, a look into heroin in Arizona. And tonight at 8 is the new Frontline investigation, Chasing Heroin. For more multimedia coverage on the impact of opiate addiction, how families and law enforcement agents are coping, and to watch our full investigation, go to hookedaz.cronkitenewsonline.com.